We sequenced the human genome in the year 2000, and our ability to understand what genes do and what they mean and how they interact with or impact disease has grown exponentially.
Genetics is an interesting piece of the medical field because it's not just about that one person in front of you. It's really a family affair, and it can have lasting effects on more than just one person and more than just one generation. So we really feel like we're taking care of the family as a whole.
We have an amazing set of tools at our disposal, and unfortunately we don't really use that technology as much as we could or we should in healthcare today.
We want to make this testing accessible and affordable and available to anybody who needs it. And we know the impact that it can have.
We've screened tens of thousands of people. Our goal is to expand our program to eventually test everyone everywhere, but starting to test tens of thousands, hundreds of thousands of people to bring this great service to the masses. And we're very excited about getting that done.
Many of our staff are patients themselves first and foremost. Many of us have experienced loss because of genetics, or experienced loss that could have been prevented by better use of genetics.
Everything we do is thinking about what it's going to be like both for the patient experience, but also is the patient getting the testing and counseling and support that they need.
There are a lot of players in the ecosystem around preventive genetic testing, and those players all try to tackle the problem and support patients in different ways. And I think what jscreen does is really sits at the interface of all of those entities and creates a super high touch, super white glove, highly personalized experience for each person that nobody else can really do.
If a person has a mutation in a cancer predisposition gene, that can give them information that can help them prevent themselves from ever developing cancer. For example, there may be specific medications they can take. There may be preventative surgeries. So this is a very powerful tool in a person's healthcare journey.
There are a few things in healthcare that have profoundly impacted the lives of patients and the health of society. Probably the easiest example of that is vaccines. I think second to vaccines, preventive genetics is one of, if not the most powerful tool that we possess.
And so when we designed the jscreen program, we wanted to make it available to everybody, regardless of whether or not they had a personal or family history of cancer, regardless of whether or not they know their family history.
The long-term vision of jscreen is to ensure that everyone everywhere has access to the genetic testing that they need to be healthy themselves and to have healthy families.
And I think the fact that we are a remote national program makes a huge difference.
Those types of things are profoundly saving lives and are arguably more powerful and have bigger impacts than all of the therapies that we try to constantly develop and move forward, which are important. Like, don't get me wrong, those are super important. But prevention is the most powerful tool we have.
I want people to know that genetic testing doesn't need to be scary. Knowledge is power. It can help you in your life. It can help you in family planning. And jscreen really provides people with the education and tools to gather that information and lead healthy lives.
If somebody has something in their genetic history that's putting them at risk, by knowing about it, there's more we can do.
There is nothing more beautiful than healthy families and long lives. And that's what we're trying to support and trying to ensure for people who come through jscreen.